Nairobi to the world. This is Look Up Radio.
Welcome back. This is Look Up Radio, and this is the Morning Drift with Liza Nyango. Please tuambieni, where are you waking up from? Where are you tuned in from? How was your weekend? How did you spend your weekend? Have you woken up today, or are you going to say Monday blues? No more Monday blues, because today we have an important topic we'll be talking about, which needs more of your attention. So I hope you're ready for that. Meanwhile, let's catch up with the world of news. It is the 18th of January 2020. Masiku zinasonga. Hey, we just started the year juicy, but like I said before, usiambie to Happy New Year. Sasa, it's the mid-month of January, and we are just all looking forward to the end of the month so that we can continue living in 2021, which we have started on a good note. Did you tune in to the Morning Drift last week? All the topics were very enlightening. And on Friday, we were talking about an important matter, generational curses. I want to find out, did you do your homework? Did you look for your family members up to the 4th generation to find out whatever it is you're facing in your family? Give us a report. The SMS line is 20374. We like to do a follow-up and to find out how you're coping, even as we continue with the topics. And today we will be talking matters mental health. How often do you check on your mental? Ama tunaishi tu ile kubahatisha, tukisema leo niko na stress, kesho I'm happy, then that's it. No, there's something called mental health which you should check into. We'll be having Dr. Gloria Simiyu, who is a psychotherapist, and she will actually just distinguish between stress, depression and anxiety, and then we'll get to learn how to cope and how to deal. Meanwhile, in the world of news, China is ready to suspend Kenya's debt over COVID-19 pressure. It has indicated that it is willing to suspend Kenya's debt as a part of measures to help developing countries weather the COVID-19 storm. How about that? Madeni tuko karibu kutolewa, yani kusamehewa. Meanwhile, a Kisii pastor has been arrested after strangling his wife over a love message from a police officer. The Kisii-based pastor choked his wife to death and unsuccessfully attempted to cover up the incident by taking her to a mission hospital where he claimed she had taken poison. And the pastor has now been arrested. A police report linked to the incident to a love message from the suspect Joel Mogaka, who found the message in the wife's phone. And today we are asking you, what is happening in Kenya? Couples killing each other, children killing parents, children stabbing teachers, and that's why we want to check on the mental. Is the mental health of people okay after the 2020 pressure and the COVID-19 pressure? So we'll be talking to Dr. Simiyu later on about that. Meanwhile, COVID-19 positivity rate has fallen to 2.1% as daily infections decline to 80. And on the international scene, Uganda's Bobi Wine is still under house arrest after poll the party has declared. Bobi Wine remains under house arrest, his party on Sunday said, after a disputed election returned President Yoweri Museveni to office for the 6th term. Bobi Wine, a former raga singer turned lawmaker, came second in the presidential election and has said the process was marred by widespread fraud and violence. Ugandan officials have said the soldiers and police were there for Bobi Wine's own security. Do you believe that? And I wonder what happens when it's Africa and elections. There's just a lot of discrepancies. But tell us what you think about the news today. The SMS line is 20374. Meanwhile, just an introduction to our topic today. We are asking, what is depression? What is anxiety? What is stress? How do you feel? How do you discern whether you're depressed, stressed, or anxious? Dr. Simiyu is about to check into studio, and today we will talk matters mental health. Are you ready? Have you had your coffee? Have you had your tea? Did you do your morning routine? Are you looking forward to the week? What are you looking forward to? Please sign in the register hapo chini. Tell us what you think. Remember, we are Look Up Radio on Twitter, Instagram, and Facebook. Karibuni sana. My name is Liza Nyango. I am ready for the topic. Are you?
Look Up Radio, Kenya's #1 gospel radio. Look Up Radio. Now playing your all-time hits. Look Up Radio.
So once again, you are tuned in to Look Up Radio KE. I'm your host Liza Nyango, and I'm asking, how is your Monday blues for who? Wake up. I'm Kenny, nilisema nitakuwa kengele. In fact, one of these Fridays, I'm looking for a bell which I'll be ringing for you guys so that you can be waking up and tuning in to these amazing topics we're bringing live to you. So today we're talking matters mental health. Have you checked onto your mental lately? How do you feel? Do you feel yourself? Are you encouraging yourself? Are you feeling low? Is it stress? Is it depression? Is it anxiety? Do you want to know the difference between all of them? Well, today we have with us in studio Dr. Simiyu. Dr. Simiyu, karibu tena sana. Gloria Simiyu. Gloria, you need to tell us, we need first of all to understand there's a difference between a psychiatrist, a psychologist, and a psychotherapist.
Yes.
Please start by telling us the difference between the three so that we can get to understand what we are dealing with, even as we introduce the topic mental health.
Yeah, thank you so much for inviting me. Well, the difference between a psychiatrist, a psychologist, and a psychotherapist is one, a psychiatrist is a medical doctor. So they go to medical school, and then after they finish, I think they do 2 years of I think specialization, and then they do another 4 years of more specialization in psychiatry. So with a psychiatrist, he can diagnose mental disorders, and most of the time they don't do talk therapy. They do more of like, they meet you probably for a 15-minute or 20-minute time. They diagnose you, and the major difference is they get to diagnose and as well as give you medication. Because for some mental disorders, it's hard for people to function without medication. And that is the difference. With a psychologist and a psychotherapist, they specialize in talk therapy.
In talk therapy?
Yes.
So the psychiatrist is the one who deals with the medical condition when it comes to mental disorders.
Yes.
What are some of the examples of mental disorders?
Well, mental disorders, a psychiatrist, I think, would deal with some of the neurodivergent people, people with autism, ADHD, and such things. But when it comes to mental disorders, there are people with very severe mental disorders that cannot function on a day-to-day, or sometimes they have psychotic breaks or some things like that. So people with schizophrenia, people with bipolar disorders, people with major depression, all this kind of
Wait a minute. I think I'm going to stop you over there. So Simiyu, Gloria,
yes,
first of all, thank you for explaining to us the difference, but then also I will request you to at least use simple English so that we can go slowly by slowly to try and understand. We understand English, but then the medical terminologies might be a bit difficult.
Fair enough, yeah.
Yes, fair enough, yes. So let's talk mental health, okay?
Yeah.
What are the forms of mental health? Because you say there's one that a psychiatrist can treat, a psychotherapist, and there's one that now the psychologists treat. Like, we just need to know the difference first of all, or maybe break down for us the word mental health in a simple way. Even if it's by giving examples, we'll really appreciate.
Yes, I would say that all of, actually research says that every human being will have a mental health issue through the course of their lives. So for some people, they might have like a little stress that they need help managing, or they just need a break. But for other people, it gets really severe, right? In Kenya, probably you would say there are people who you would say the most extreme are people we call madmen, crazy people. Such people who are like completely cannot function. Such people would probably need to see a psychiatrist. And then everyone exists either on the mild, moderate would say, or severe, or just in the middle, where you can function, but sometimes you're like, I'm feeling very stressed. And some people have good self-soothing skills, so they're able to like realize, okay, things are not going well right now, so I need to take a break, I need to go meet with my friends, I need to go for a jog, I need to take care of myself. But it's very important to realize that when it comes to a certain point, there's chemical imbalances, there's a problem with the way your brain is set up, and this can cause you to completely not be able to function. And that's still okay, because we are all different. And that's what people should realize, is that if, for example, one day I wake up and I have major anxiety disorder, it just comes on. It has I cannot explain why I have become an anxious person. it's okay to go see a psychiatrist if it's so much that it is really messing up your life. Or, for example, if you have an addiction, people usually look at addiction as a lifestyle thing. But for some people, it's actually
An escape.
Yes. Yeah, for some people it's an escape from traumas and things they've gone through, and they do need to see somebody. It gets to a point where you do need to go see a therapist, a psychologist to help you manage. And that's okay. Yeah.
Okay, I think first of all we can start with let's say stress. Stress is the most is the less of an enemy when it comes to mental disorder. So we'll first of all talk about stress, depression and anxiety, which is our topic today. Then maybe later on we can delve into now the other forms of severe mental disorders which you mentioned. I don't remember the names well, or maybe I just can't pronounce the names. But let's talk stress, anxiety and depression. Maybe we start with stress. What causes it? How do you know you're stressed up? How do you discern between now anxiety and depression? Because you're talking about anxiety, and I'm sure maybe there's somebody out there who doesn't even know what anxiety is in the first place.
Well, I would say that stress is a very natural part of life, and in some instances a little stress is good, because a little stress helps you, it helps you, for example, get your tasks done, meet your deadlines and things like that. But when it becomes pervasive, pervasive meaning it is existing all the time in every aspect of your life. Sometimes it's unreasonable, and you would say unreasonable is very subjective word. If someone tells you your stress is unreasonable, you're like, it's very reasonable that I'm stressed about my finances, right? It's very reasonable that I'm stressed about my children, right? But as I said, it gets to a point where you cannot self-soothe. And what is self-soothing? I would say self-soothing is an ability, just like a child. If some children, if you put them in a cot or in a bed, they'll cry a little and then they'll look around, they'll find some things to distract them, they'll crawl and find a thing to play with. So as an adult, with time, I say, as you grow older, some people, depending on how they were brought up, the resources they had exposure to, those people might have, the skills to be able to say, okay, now I need a break, right? Or, okay, this situation is toxic for me. Okay, this friend is a person who probably I don't need in my life. Okay, this husband needs a sitting down with and talking to, because venye ananipeleka is not right.
It's not right. Okay. Okay. Gloria, once again we are grateful to have you here, and I think you're breaking the topic down for us in a great way. Andrew Okalhaya is watching. Andrew Karibu Sana, and he's saying mental health, great topic that is really ignored. Today we are talking stress, anxiety, depression. Do you have a question? Do you feel stressed? How do you know you're stressed? How do you know you have an anxiety condition? And how do you know you are depressed? And then how do you deal once you find out? So we are saying the problem could be there, but then what is the solution and how do you cope? Do you see a doctor? Do you not see a doctor? So Gloria Simiyu is here to tell us how to deal with all this situation. But now we'll just go into a short break. When we come back, we are waiting for your questions. Tafadhali tumeni message 20374. We are waiting to hear from you. This is your topic. This is for you to comment, and we want to hear from you. Tafadhali, send that. Come back. Indeed, it is a great morning. Where are you waking up from? We'd like to hear from you. What do you think about what has been happening in the world today? In the news today, we were reading about how a Kisii pastor was arrested after strangling the wife over love messages from a cop. And we are in studio and we're talking matters mental health. Have you checked into your mental lately? Do you think whatever is happening in the world today is all about stress, anxiety and depression, and people are acting out? In fact, I think Simiyu, you need to talk to us about that. We have an issue of a Kisii pastor who strangled the wife, but that's not even the big deal like what happened last week in the country. Students are stabbing their teachers. We have an issue of a child who killed the whole family. We do not want to diagnose because we are not doctors, but we are just saying, could this be forms of stress, anxiety and depression, or what could we term these killings into? Like, which category can we put whatever is happening in the world into?
Okay. Yeah.
Hard question, yes? Tough one.
It's a very tough question because it's also really hard to know people's specific issues. But I would say we're living through a pandemic. I feel like I like that saying where people somebody said we are all in the same we are all in the same storm, but we are not in the same kind of vessel. You know, some people are in yachts, some people are in big boats, and other ones they're just hanging on a piece of wood or something.
Okay.
So this pandemic has affected people in so many different ways, and also I would say financially, socially, some people have lost loved ones. So I think that is like a collective kind of trauma that we're going through. But at the same time, there are those socio-economic issues that are existing that are just
For example?
like poverty. You know, these are issues that have been existing and they're getting worse and worse and worse for many Kenyans. You know, and that can come out in very anti-say social ways. It can come out in criminal ways, and it can come out in, you know, because some people, when they go through stress, they bring it out on their family. But I would not justify killing your family member as a socio-economic issue. I would say that is either personal or situational to that person. Because it's kind of gendered for you. It's there's a gender aspect of feeling like you're so entitled to your partner that you will kill them that they have a lover. You know, people get cheated on. The most healthy thing is just to move on.
Easier said than done. Easier said than done, as you said.
I have been cheated on. I know. I did feel like.
So you just manage your stress, whether or not or whether. That's what you're saying, yes?
Yeah.
Okay, let's talk matters anxiety. And I won't even ask you what anxiety is. Let's just give a basic example. What is a basic example of somebody who has anxiety? Then you say there's a difference between anxiety and the disorder.
So
what's the difference and what are the examples?
So I guess I will give you like a snapshot of someone who I might see as a therapist, who I might recommend to go see a psychotherapist. I'll see this person when they come in to see me. I might notice their physical presentation. First of all, the way they look nervous, or maybe they just look sad. And then also I'll notice their state of dress, because like it or not, most of the time when you're going through extreme stress, but this is not always the case. Sometimes your clothing, the way you present yourself might deteriorate. But also there are people who are anxious but very well put together. So also it's so this person will say to me, I stress all the time, I overthink all the time, I'm irritable with my family. So I'll ask them, how long have you been stressed for? And then they'll say, in a week, how many times? So maybe we might be checking, you know. So in a week they'll say maybe six weeks, or like 6 days I'll be very stressed. And then if this is going on for 6 months, then that's one tick. You pass anxiety disorder. That's one tick. So you have to satisfy several, about 5 or something. And then second, is it affecting your day-to-day functioning, your efficacy? Your efficacy is like your ability to put out, you know, your potential at work, for example, your ability to put up your best effort. Are you getting into problems at work? When you wake up in the morning to go to work, do you get like, oh my God, like you get nervous, you know? And then also a person with anxiety will start feeling like muscle pains all the time.
There's actually a body feel.
Because we carry our stress in our bodies. So there'll be muscle pain, and then you might start having gastro issues, your stomach issues, you know. And then also this person will definitely be struggling with sleeping.
Anxiety, sleep disorder, insomnia is part of that as well.
Yes.
Okay. So a quick question is how do you now approach your doctor, and what will the doctor help you with? Like, let's say you're anxious, or how do you cope, first of all, before you even go to the doctor? How can you cope with an anxiety disorder?
Well, I would say it's, if it gets to a point where it's a disorder, it might be really difficult for you. It
Okay.
might make life really difficult for you, and it would be just good for you to go see it. I know as a human being, our bodies are really good because our bodies tell us, okay, now this is too much.
Okay.
Because most of the physical symptoms, you'll actually start going to hospital a lot, right? The way they say, if you don't drink water or eat well, so with your mind, you'll start going to the doctor a lot because you'll have physical symptoms. It will exacerbate is like it will ongeza. If
Okay.
you have diabetes, if you have high blood pressure, if you, it ongeza sana. Yeah.
Okay. So, what are the common symptoms of the anxiety disorder? Symptoms.
Yeah,
Yeah.
they're the ones I've said.
They're the ones you
Yeah.
said. Okay. So, what are the treatment options for those symptoms?
For some people, psychotherapy can help.
Okay.
Yeah. And a psychotherapist in Kenya can...
Tell us what is psychotherapy.
Psychotherapy is literally
break it down.
talking.
Talking.
Talk therapy.
Oh, okay. Talk therapy.
Talk therapy.
Okay.
Yeah. And then for some people, they need medication. The medication will, they'll work with a therapist, psychiatrist, and then they will balance out. Because
Okay.
you know, it's chemicals in your head.
Okay.
They go wrong. And then now you're just like, what is happening to me? If it becomes a disorder, for some people, they might benefit from getting medication. Some people might benefit from both. Anapewa dawa na tena anaongea na a specialist. And it's good to let you guys know that some psychotherapists actually, there's some who do pro bono.
Okay.
Yeah.
Oh,
even
there's some who do for free.
Yeah,
Like you just
they
talk
do
to a
like
doctor
they
for
have
free.
like
Okay.
they do like 2-3 clients pro bono for
Okay.
free. Yeah.
Okay.
Yeah.
Oh.
So even me, I do take once in. I do every month. I have
Okay.
my free clients.
Free clients.
Yes.
Okay, can we have one of our clients get a free session? But please sign in the register. The SMS line is 20374. Do you feel like you need to see somebody because of something you feel you're facing in your life right now? We are saying life is not easy. It was 2020 and now it's 2021 and we're just checking into the mental health today. Do you feel like you need a free session? Please sign in the register HAPO 20374 and then we'll see who will get this free psychotherapy treatment. Gloria, where do we get you? Where are your offices, or how can we reach you out in case we are giving out the free
I think
psychotherapist treatment?
I'll give out my number, my work number.
Yes, okay.
And then also I can give out my Instagram where you can DM me.
Okay, so you guys don't go anywhere. Later on, we will be giving out the work number. So we've talked stress, and we've talked about anxiety. Now let's talk about the bigger problem, depression.
Yeah.
Depression, like the cases we are hearing about. He was depressed. He killed himself. He was depressed. He did this and that. So let's talk matters depression. What is an example of depression, or even just tell us how can somebody tell they're depressed?
Okay.
And how bad or how severe does it get?
Well, for a very severe person, and I know some people here might have an idea of a family member, wanasema huyo analala tu, unajua hatokangi kwa nyumba. It can manifest, somebody can even think you're lazy because you can just be sleeping or you don't leave the house, you stay, and then it will also manifest physically, either extreme weight loss or extreme weight gain, and then also sleep issues. So a very, very majorly depressed person will probably have very much trouble leaving bed or leaving the house. Actually, most of them, they just stay in bed. For the people that I've worked with who had major depression, they just stayed in bed all day for like weeks.
Seriously?
Yes. They might even have a problem feeding themselves, because one major diagnosis of major depression, depressive disorder, is lack of motivation kabisa and hopelessness.
And how does it get to be now depression, to be that hard?
And
how does it get there?
I would say major depressive disorder is a mental disorder. So there's something wrong in your brain. So you need medication.
Okay.
Yeah.
What caused that something wrong? Stress, whatever. Like we need you to break it down, so that whoever who is watching can understand. Now this is depression. Now I'm dealing with stress. I'm dealing with anxiety, and this is how I can get help. Because you cannot offer a solution to something even you yourself you don't understand.
That's true. I would say that It's really hard to say what causes this because the research says it's either nature or nurture. And as we go through life, we experience so many things, right? Yeah. There are people who are dealing with trauma, or they are really, you grow up and then you relieve that trauma. You go through the trauma that you experience. You know what I mean? Yeah. You start now realizing, hey, my childhood was bad.
Okay.
Or if you live in, always stressing about money and stuff, it can get to a point where you're just like, this life.
It's also about just giving up and sulking. Is that it?
I wouldn't call it sulking.
You didn't call it sulking. It's important, yes?
Yeah.
Okay, so you have heard from Gloria Simiyu. Today we are talking about an important topic that has been neglected for a while, mental health. And we've just focused on stress, depression, and anxiety. Simiyu, mental health has a wide angle, right?
Yeah.
Can you just give us the wide angle so that we can know as we go how we can be breaking it down for people who are listening and even watching? Even as we continue, we will still break down depression until the end and figure out how or if we can save a life out there, right?
Yeah.
Okay, so please just give us the wide perspective of mental health. We have, aside from stress, depression, and anxiety, what else is there?
I would say it's just all your psychological makeup. And how your day-to-day functioning. So mental health, as I said, is from you being completely okay, and then to you being like stressed, to you having complete and utter breakdowns. And this can happen in anything. And it's important to realize that life issues like grief and loss can affect how you deal with how your mental health is.
Even grief and loss can cause depression, stress, and
pregnancy
anxiety.
can cause postpartum depression. And there's just, we live through life and every day is is a new ball game. We totally
understand. Now there are ways in which people have tried to self-cope or soothe. Like you gave an example of how a baby can soothe themselves, and babies soothe themselves, yes? So there are ways in which people have tried to soothe themselves, and now one of the ways is like alcoholism. And I can see Mwitu is in the SMS portal, and he's asking, so unatuambia tupatie mwili pole, ama you're challenging us to act how, or what are the unhealthy ways versus the healthy ways of soothing the body against stress, anxiety, and depression?
I like that. That's a very Kenyan way of saying self-care. Patia mwili pole.
Yes,
take a break. Like realize that, like, how you've gotten yourself up to here deserves recognition. Just you getting here deserves recognition. You deserve to realize how resilient you are, that you've lived through whatever you lived through in life, and you're here. And the way you went through this, one of your worst experiences, is the way you'll continue going through some of the other life experiences. So like that is I like that. Kupatia mwili pole. Okay, so let's talk stress, anxiety, depression, and the big enemy, alcohol. Yes. Yeah, I would say, like, I usually try to work in a trauma focused way. So I always try to understand what is the background of this person who is abusing alcohol, because I think that's what you're asking. Addiction.
Addiction. Even drug abuse, like all forms of addiction. It's
just trying to understand how did this person get to this point, and trying to walk with them in the journey. And I would say, if you're the person with an addiction, or your family has an addiction, najua ni ngumu sana for both the people affected and the people going through, like the family members and the person who's addicted, because of course both of you don't understand each other, and there's going to be lots of relapses. But I think the most important thing is to always try, like, to get better. That's why, like, even when you go to rehab and you relapse, just encourage yourself to keep on going.
I think on that note, we'll take a very short break. Cynthia has a question which we'll address when we come back. If you're tuned in, it is the Morning Drift. And what are your questions about stress, anxiety, and depression, and how to cope? Any question you have, sign in the register hapo chini 20374. We'll be right back.
The This is Look Up Radio, Kenya's #1 gospel radio. This is Look Up Radio, Kenya's #1 gospel
in studio right now. Lakini mnatusikizia mkiwa wapi? Mumeamka ama ni Monday blues for who? Tafadhali tell us on our SMS portal 20374. Today we are talking matters depression, anxiety and stress, and we are just saying, how do you cope? How do you manage? How do you wake yourself up when you can't do anything, like you feel like sleeping the whole day? Like, how do you pick yourself up? And in studio we have with us Gloria Simiyu. Gloria, karibu sana, welcome
Thank
back.
you.
So Gloria, before we went on break, Cynthia asked to our guest, do you also see a psychiatrist? Like, does a doctor treat a doctor, or how does it go for you?
Yeah, I'd like to clarify, I'm a psychotherapist, I'm not a doctor.
Uh-huh.
But I don't see a psychiatrist, but I see another psychologist.
Oh, you see a psychologist.
Yes, and I think every good psychotherapist, mental health practitioner sees another one.
Okay.
So we can deal with our issues
before
we can deal with other people's.
All right. So this is like sort of like a follow-up show
Yeah.
on what we did on Friday. On Friday we did generational curses, and we just basically talked about how a curse is brought forth from one generation to another, and we are asking, among the people you've treated, based on the different forms of maybe stress, anxiety and depression, do you believe like sometimes the condition comes from back from the family, or how? What do you think about that?
Yes. There's one type of therapy that we do where we trace back. You come see me, and then we do a family tree. Then after we do the family tree, you first of all put from your grandparents down to your parents, to you. And then after that, after you've drawn who is married to who, his children and everything, now you start writing nani na nani wamekosana, nani na nani who's still married, who's divorced, right? Who has cut off others, who has maybe died by suicide, who has died at a certain age. It's so fascinating that for most families you see the same. You see the same strains of things. So some of the things, the traumas that you have now, you're carrying from your great your grandfather. There's traumas that happened, and also we have this saying that the body knows the score. The body knows. There might be a family secret. Haujui lakini unajua. You're living the toxicity of that secret. Okay. Yeah.
Okay, so how do you help your patients or even your clients to overcome, or do you have a success story of someone who you've worked with and they've managed to manage maybe a generational form of mental illness?
I would say I use this framework with all my clients. Tunafanyanga hivyo, lakini kuna wale watu wenyewe mnaangalia na realize kumbe maneno ya divorce ina happen in my family. That's why I'm struggling in my marriage. This is how I've learned to deal with issues. This is how my mother dealt or my father dealt, or this is the fears that I hold. Unaona? Ama kama kulikuwa na mauaji, maybe it might still have been like mtu aliua mtu, but it was never dealt with, but it is still it is manifesting. So that helps you also to remove yourself from toxic family relationships. See, you don't have to cut off, but you don't have to keep on playing that toxic game. You can start now building healthier relationship, or unaweza jitrain paka ukikutana na that very toxic person, you're okay, anafanya drama yake, but you're fine, because you have learned this is a pattern, this is what people do, and I don't want to play that game. Obviously everyone benefits from that. I have done the same with just realizing what are the patterns in my family, how have I been reacting, because all of us, we have that rejection framework. I can say this, that you've been rejected at some point. Your parent, at least mama, you feel like your parent loves somebody else more than you, maybe your sibling, and then it's living out. Unajua ukienda ushago, yani unakuwa too hard to deal with, because there's that rejection thing that you experienced when you were a child and you're still going through. So it's very like nice to go back. Even any other person, I can guide people how to do it. without having to see a therapist.
Oh, without having to see a
Because kuna
therapist.
watu wenye hawana pesa, I can guide them how
Can
you do it. Yeah.
Can you give us a basic guide on how to just bounce back and realize what is eating us up? Because you're saying these are some of the triggers that are causing stress, anxiety, and depression. Can you give us a sample of the guide? Or is it a long sort of a guide that you can't give right now?
But the way I'm saying,
in basic,
the way I'm saying is just being introspective. Unajua, you can't change anyone else. You can change yourself.
Yeah.
You can change how you react to those people, right? Kila mtu ukimuuliza sasa atasema kuna mtu toxic in my life. There's somebody mwenye nikikutana naye, the worst parts of myself show up, right? So nistaki kukua hivyo anymore.
Okay.
And that's why people start doing shadow work, child work. Child work ni think about your child self, those child wounds that you have, and you become your mother. Kitu ikikuwa triggered, una realize hii kitu nimekuwa triggered ni kwa sababu ya my experiences as a child, and then you soothe yourself. So ukijisoothe, after that, even the way you react to people will change. This can even help your relationships now. It can make them healthier. Or kama uko na struggle with even finding good partners, then you disconnect from always dealing like that. You disconnect, you decide. It's actually a decision. You decide, I am not going to play that game anymore.
Okay.
Even with your family, you're like, I'm not going to play that game anymore. I'm going to be the healthier one. I'm going to role model how I want us to react to each other. You're going to set boundaries. Unajua, unasema tu mami, mimi nikikuja nyumbani, usiongee juu ya bwanangu, tutaongea juu ya bwanangu. If that is the cause of issues. Ama unawaambia mimi sitawahi kwa tajiri, mni accept tu hivyo. Kama that's the issue. Ama mimi sioleki sahi, tusiongele.
Okay. So Simeon is asking something that is related maybe to mental health. What is a personality disorder? Do you believe like there are people who have a personality disorder?
Yes.
So what is a personality disorder?
Yes. Personality disorders ziko kwa hiyo DSM-5 ziko classified. Hizo personality disorder, kuna antisocial personality disorder, ndio ile watu wanasemanga narcissism.
Narcissists.
Yes.
And this topic has been quite something. Narcissists. Yeah. Just expound to us who's a narcissist. What's a narcissist? I'm a behavior too, so behavior that we can understand. Narcissist. Yeah.
Well, mi watu wanasemanga narcissist. I think the core thing that you need to understand.
And mostly it's women who are complaining about narcissists on social media. And this comes about when a relationship has ended and you're looking for a way of dealing, and they say he was a narcissist. So what's that? Yeah,
I think it's a spectrum. Spectrum yani ni line. Kuna narcissist, kuna watu wenye ni complete narcissist, and then you can have narcissistic behavior.
Okay.
Yeah. So ninaweza sema a narcissist is somebody, first of all, you have to understand a narcissist has a wound.
Okay.
And their wound, the thing that they are dealing a lot with is shame. And to cover the shame, all of us, we have shame. But all the problem with, and it can actually happen, and then you start creating shame around that thing. But for that person, they have a core wound of shame. Now, badala, they deal with the core wound of shame with other ways, like healthy ways. They cover it up by being, extra, like, they want to, they're very difficult people to have relationships with because they're very charming. One very good nini of a narcissist, how to identify a narcissist is they are very charming. But it's a kind of, wanasemanga glib, it's very surface level. That is why ukikutana na mtu mwenye 1 week, yani before mjajuana, kwambia the best person that I've ever, you're the most pretty girl that I've ever seen you. Yani hiyo nini ile praise anakupea, it doesn't sound natural.
You're the prettiest thing, ama ni mapenzi tu, or what are you saying?
Yes, in relationships they do tend to go very fast. They do tend to commit very fast.
Yes.
And for all of us who've been wounded through our relationships, all of us are looking for that, great romance.
Okay.
So ukipata ule mtu amecommit so fast. So that is one warning sign. Too charismatic. Wako very like charming.
Okay.
But there's different charm.
So where
Unaona kama
comes the challenge?
you're charming, but it feels natural.
Okay.
But kuna wale charming, you're like, no, this is not natural.
Okay. And where does it become now a threat?
You know, they
After
are
that
very
charm.
Yeah. The when you're
How does it now become a personality disorder? Because just to expound on the question that Simeon is asking, maybe he'd like to understand how this goes. Yeah, you've given a narcissist as an example of a personality disorder. I know there's also bipolar, and maybe we can talk about one more.
Yeah.
But how does being a narcissist now become bad? Because you say they're charming, so it's good to have somebody who's charming.
Well, they are charming, but they are very manipulative. They don't form any. They don't have the ability to form any real human connection with people. So they manipulate people for what they can get from you. Na kichoka na what they like when they get what they've gotten from you, or when they realize that you notice that they are not as big, as amazing, as grand as they are, then they discard you. But they will cause you a lot of trauma before they leave you. They'll gaslight you. Gaslighting is one very key.
What is gaslighting? Yes.
Gaslighting. There was this.
Today we've gone back to biology class. Are you guys paying attention? We've talked about a narcissist, and then now we're talking about gaslighting. Let's talk gaslighting. Yes.
Gaslighting actually comes from this movie. The movie was about a man and a woman. So this man decided, I'm going to make this woman think she's crazy. So kama for example, anastick kwa nyumba, anazima taa. Ama anastick kwa nyumba, anawasha gas. Anastick kwa nyumba. Sasa huyu anashangaa, kwa nini hizi vitu, like you doubt your own reality. So that's what gaslighting is. Who are invalidating your reality. Sindio? Mukisema, I think I'm smart. Mwenzako, your partner, bwanako anasema, you're not smart, you're stupid, nini. Ani invalidate. Kila kitu yenye unasema, anakupea opposite. Alafu tu unaweza mwambia, leo kuna jua, anakuambia mimi sioni jua.
Okay, but a basic example is sort of like, you mean gaslighting is somebody who brings people down.
Yeah, they bring you down.
No matter how up you feel you are, or no matter what your reality is. And if you're not a strong person, then this person can bring you down, right?
Yeah. They really because they are manipulating you for you to become a vessel. You know, unakuwa tu a vessel for their desires.
Okay. Yeah. So that's well understood. So please break down depression for us so that we can get to understand what depression is, signs and symptoms, and how to cope, even as we wind up. And if you're tuned in, remember the SMS portal is 20374, and we are looking for your questions. Thank you very much, Simeon, for asking a question through the SMS portal. If you're feeling like you don't want to ask a question directly through the comments that are trickling in on Facebook, and you'd like to ask a personal question, we have created that portal for you. Tuma to message and we'll address the question. Also, it's a learning curve for everybody. So what would you like to learn on matters mental health? We've now talked about personality disorders, which, Simeon, thank you very much for asking that. So we've talked about a narcissist. So what other personality disorders are there that we should be aware of, that are like sort of like more rampant in the current generation we are in?
Yeah.
Because words zingine, I'm not going to lie, Gloria, some words I came to hear just the other day. I'm sure even you guys are wondering. I started hearing anxiety the other day, also started using it. Then now we have narcissist, and then now we have gaslighting, which has come into play. So what other forms of personality disorders are there?
Yeah, I don't want to go into all of them because there's so many. But I would say a person with a personality disorder, I would say they border on to like kind of criminal behavior because they don't consider our social norms and legal, like they feel like they are above it, right? That's why most people with personality disorders, they always end up, they might end up committing crimes if they are caught, or murdering people, things like that. They are remorseless. You know, ile kitu yenye we unasikianga aki nimekosa, them they are like, it's just as long as I achieve what I want. So personality disorders, they're very wide, they're very ranging, but I would say,
like, name one of them.
There's so many,
bipolar?
And there are clusters.
Let's talk bipolar.
Bipolar is not a personality disorder.
It's what?
It's
condition?
Just a mental condition. Condition.
Okay, please expound on bipolar, because I can see somebody asking. Betty is asking, my friend tends to switch on and off based on the personality, and I'm suspecting it is bipolar. So please expound on that.
I just mentioned in general, but there's different types of bipolar disorders, but I'll just mention like a person dealing with bipolar will definitely have depressive moments and manic. That's why she's saying. So, but it can't be like today I'm down, tomorrow I'm up. Mostly it's like they go through a season of depression and then there's a season of manic. Manic ni ile hyperactivity and sasa lakini kwa bipolar, for the people I've seen, even when they become depressive, it can be really bad. Kuna watoto wenye wani anakuwa so, yani silikwambia depressive, kuna hiyo lack of activity. Your activity level inaenda down sana. Si ndio? So kuna watu wenye hata they can even like pee on themselves, like they don't even want to leave bed to go to the toilet. But this is not typical. This is the most extreme,
Okay.
So I don't want to, obviously, when we talk about mental disorders, we don't want to make someone, even the person who has bipolar, to feel stigmatized against. Easy vitu, they happen to anyone.
Okay.
Yeah,
It can happen to anybody. Okay, so you heard, I hope you're learning, and please tell us where you're tuning in from. We will take a very short break. When we come back, we will wind up the topic of today. In studio, we have Gloria Simio. And maybe even before we go on break, Gloria, do you have somebody in your family who's had a mental condition that you've had to treat as a person?
Well, I cannot treat family and friends.
Oh, why not?
Ethics. Yes.
Okay.
I cannot treat family and friends. But yeah, I've seen people who've had a psychotic, I think it was related to, what is it called? Postnatal depression. And then they had depressive psychosis.
Okay.
So that's when like somebody has given birth and they get depression and then they just go. You know, like anaeribika kichwa.
Okay.
Yeah. But they got treatment, they healed, they're okay.
Okay.
Yeah.
Sawa. So let's take a short break. We'll be right back. But please tell us where you're listening from and keep asking the questions. You're asking important questions. Remember, this show is for you. The Morning Drift is all about the mind, body, and soul. And today we are talking matters mental health. What is your opinion? We'd like to hear from you.
From Nairobi to the world, this is Look Up Radio.